Welcome to the Speaking of Women's Health CME podcast. I'm your host, Dr. Holly Thacker, the Executive Director of National Speaking of Women's Health. And this is a special CME continuing medical education podcast for physicians, physician assistants, nurse practitioners, and registered pharmacists. And this is sponsored by a grant from Astellas and Bayer in conjunction with Rush University, Plexus Communications, Advancing Health After Hysterectomy, and our own nonprofit, Speaking of Women's Health, which is dedicated to empowering women to be strong, be healthy, and be in charge. You can find out more information about this program and the free CMEs and other CME podcasts on menopauselearning.com. Back in the Sunflower House, joining us is a wonderful friend and colleague, an excellent physician, Dr. Sobia Khan. Dr. Khan is a board-certified internal medicine specialist, and she completed a specialty women's health fellowship at the Cleveland Clinic with our team a decade ago. She also holds a doctoral degree in professional leadership and health science education from the University of Houston. Prior to joining us as staff at the Cleveland Clinic as a menopause and functional medicine women's health specialist, she served as director of the Women's Center for Comprehensive Care at Baylor College of Medicine for 10 years. She's a wonderful wife and mother of 2 terrific children, and she is certified in functional medicine, and she is now offering women's health functional medicine consultation at the Center for Specialized Women's Health at Cleveland Clinic. And she was part of our faculty program on non-hormonal vasomotor alternatives for midlife women. So thank you so much for joining us in the Sunflower House, Dr. Khan. Welcome.
Thank you so much, Dr. Thacker, for this opportunity. I really appreciate it.
Do you want to tell us a little bit about your training in functional medicine, what attracted you to functional medicine, and how functional medicine can help patients or complement kind of traditional allopathic medicine?
Absolutely. So I really feel very blessed to first have the knowledge of women's health and being certified in menopause. This has been my passion for years. But as my practice grew, I noticed that women are very innovative. They want just not one kind of treatment, but they would like a holistic approach to their care. And that led me to be looking for a program that is more geared towards authentic, holistic approach. And Cleveland Clinic has always been my compass. So I look back at what is Cleveland Clinic endorsing when the world is moving towards lifestyle medicine. And they were very much interested in certification in functional medicine. So I started this journey almost 7 years ago. So it took me almost 5 years to get certified in functional medicine. You have to attend certain modules, get trained, then take examinations. And it was all for my patients so I can get them the most accurate and scientific approach towards complementary medicine or functional approach towards holistic medicine.
And how can functional medicine help treat the vasomotor symptoms, hot flashes, hot flushes, that affect sleep and the circadian rhythm in women?
And this is really the core question. And I will tell you that my knowledge in menopause helps me tremendously to risk stratify patients for treatment of vasomotor symptoms when they're in their perimenopause and menopause age. The idea is that what is safe for them. And also, there are stories behind patients as well. Some can really be more geared towards getting hormone therapy, and some could be absolutely against them. So, you really have to understand their perspective first and then advise them accordingly. And functional approach is, of course, more natural approach. So, when patients are involved in this kind of treatment model, they have to be very, very committed and they have to understand that it will not immediately help them. It has to be very strategic and very much structured approach. And it includes, of course, the diet, exercise, their stress management, and moving forward, certain botanicals and herbs and complementary medicine, which could be acupuncture, meditation, yoga. So, all of this is a holistic approach, and you have to meet the patient where they are to help them with some of these modalities.
And for our listeners who are allopathic practitioners who have patients that the standard medical approach is not enough for in terms of hot flashes or sleep or mood or joint pain, weight management, sexual function, all these concerns that are very common in our female midlife patients. How does someone go about finding a practitioner who is certified, uh, who might be in your general vicinity?
For functional medicine, actually, we can go to the Institute of Functional Medicine website, and all the certified practitioners are listed there. So, in their vicinity, they can sort it out, who's the closest.
Can you give us that specific website and any other websites that you think are excellent resources for clinicians and patients?
Sure, I can share those websites with you, and certainly patients all across the United States can see that functional medicine practitioners are spread out. But I cannot speak highly about all of them being women's health expert as well, because functional medicine, of course, is geared towards all different kind of chronic disease management. Precisely about menopause and vasomotor symptoms, I think we have to have more of a hybrid model of being expert in menopause as well as functional approach.
Okay. And so, what kind of patients are most likely people that you can help? Women that just aren't getting relief with hormonal or non hormonal options, or women who don't want any kind of prescription therapies?
I think functional approach is across the board for everyone. And I am very much blessed and I'm very much happy with the kind of hybrid model that I have, in which I'm able to advocate for hormone therapy when it's needed. And if patients are not willing to initiate the therapy, then I will offer them other modalities. For, for example, starting from the gut, trying to help them with the gut health first and help them with the gut brain axis, because it helps them a lot to just make the right decisions for themselves. And sometimes they are so much on the autopilot day to day, they do not make the right choices for them. So, teaching them how to be mindful about each bite of food that they're taking, and then also helping them with the right kind of supplements. Even though patients say that, okay, I did this all my life, now why is it happening like this? Every organ and every cell has a life, and gut has a life as well. And if we have abused our gut for years, it doesn't mean that it will keep on responding to the same food even when we are in our 40s or 50s. So detoxifying our foods, eliminating the inflammatory foods, and trying to just like heal the gut first, so any kind of treatment that they will take, it will help them better. Even the supplements will not get absorbed in the system if they are not eating the right kind of food, because majority of them, they don't know that they are fat soluble vitamins. They will take them empty stomach, and then they will think that okay, they should be helping, but no, really it's not helping them.
And can you talk about how functional medicine can help treat vasomotor symptoms that affect sleep and the circadian rhythm?
This is a great question, Dr. Thacker. Circadian rhythm is something that we all have to focus on. And especially, sometimes when we are located in a zone where sun is not out so much, we really need light therapy to help stimulate our wakefulness. Why is it important? Because it, of course, affects our pituitary gland, our brain, in a way that the right kind of hormones begin to flow. So, estrogen is important for women, but equally important is our cortisol, and when it should be high and when it should be low. It should be high in the morning and it should be low at night so we can unwind better and sleep. That's why many women, they stay wired and they cannot fall asleep, or even if they fall asleep they wake up because the cortisol has these spikes and it doesn't let them unwind. So why is it happening? It's because their rhythm is off. Once they get into rhythm, melatonin begins to kick in and they go to sleep well. In the morning, cortisol is high, it supports their metabolism, they're able to digest the food better. Therefore, we suggest that they should be doing their cardio workouts in the morning because that's the time to actually stimulate the metabolism. And if they want to lose weight, then they should be doing it empty stomach. It's very hard to do it empty stomach, and I'll give you a tip here that broth helps a lot. So instead of like drinking Gatorade and other kind of drinks, it's better to maybe have a cup of broth before their workout so they have high protein and they can do a cardio and they can lose weight but at the same time build muscles.
Do you do a lot of intermittent fasting in your functional practice in order to help with weight loss and to help reduce diabetes and improve energy and focus?
Calorie restriction and time restriction eating is the key. So, time restriction is very, very important. And intermittent fasting gained a lot of momentum at one time. But now we are hearing more stories about intermittent fasting with the circadian rhythm because everyone was breaking their fast maybe at 2 o'clock in the evening and then not stop eating till 8 o'clock, which did not help their belly fat. So, going with their rhythm again and maybe breaking their fast with a good protein in the morning and then stop eating around 2 o'clock. I'm not saying that get dehydrated. I usually suggest to my patients to go with hypoglycemic or low glycemic kind of diets or fruits that will help them, such as watermelon juice or berries. And not like in a big quantity after the fast is done because it will still stimulate the insulin and cause resistance. So if they truly want to lose weight, then they have to follow this kind of a program. And there are various resources out there, and we have to be careful in telling patients not to be so vested in them because there are ways they can do only fasting on the juices, or they can do it only on certain diets and for maybe 7 days, which is kind of very debilitating. The idea behind intermittent fasting is to detox the liver, and if we are able to follow well a program which is like 8 hours of eating and 16 hours of fasting, it is pretty good. And if you blend in the timing, the right timing with it, you're able to lose weight effectively.
We'll be back after a quick break.
Hey, quick question for you. Are you someone who wants to be fit, healthy, and happy? And what if I told you you could get your dream body by simply just listening to a podcast? I'm Josh.
And I'm KG, and we're the hosts of the Fit, Healthy, and Happy podcast.
Listen, we get it. Fitness isn't easy. Carbs, no carbs.
Just stop, okay? It doesn't have to be that complicated. And that's why we made this podcast. We get straight to the facts so you can become your best you.
So the way to check us out is click the link in the show notes or search Fit, Healthy, and Happy podcast on any of the major podcast platforms. We'll see you soon.
Well, certainly that's what I try to do most days is at least 16 hours of fasting. That's for sure. And I certainly recommend it for patients interested in anti-aging, reducing diabetes, and for all the patients that we have with fatty liver, because that, of course, can lead to cirrhosis in some women. And so I think that's very important. It's not for everyone, certainly not pregnant women, certainly not children or people who have migraines that flare if their blood sugar is not controlled. So it seems like there's a really strong role for functional medicine for sleep hygiene and exercise and diet, gut health. Are there any specific functional medicine, brain fog, memory tips, supplements, recommendations you have? Because I know that's a big problem with midlife women is the brain fog and word finding difficulty. And certainly estrogen's great for the neurons. But if women are already on it or they can't or don't want to be on hormones, what are your functional medicine recommendations in that regard?
So I certainly check some of their very important minerals and vitamins, checking methylmalonic acid, B12, vitamin B6, homocysteine levels, magnesium, omegas, And at times, I even check for the CRP, which is the marker for inflammation. It's a very subtle marker, but then it is a good indicator of like you're getting better or you're getting worse. And now that we know that everyone is very visual, some of these markers help us tremendously. So, patients, when they're taking B12 for memory, at times they do not know they actually need to take methylated B12. So this helps them a lot to metabolize it better in the right way and help their memory and focus. There are lots of ways that they can improve their brain fog. And we already talked about the significance of the sleep and moving on with the rhythm, but making sure that they are also on some sort of a detox. Like getting the toxins out of the body helps them a lot with their focus and energy. And practicing meditation goes a long way to improve the brain fog and the memory. There are certain websites and resources that I will share with you that we commonly share with our patients who come to Cleveland Clinic for functional medicine consultations, such as doing brain math or walk with the nature. Some of these ways to maybe get programmed and structured in what they're doing. Because we all think we are doing enough, but we are not doing it in a very strategic way.
So, some of these resources that you've mentioned earlier and again, we will be sure to put on menopauselearning.com. So, it'll be patient education resources for your patients or other resources for people across the country looking for information in functional medicine, which is certainly growing, and there's more and more patient awareness of this field. Can you talk about some of the functional medicine techniques that lower catecholamines? Because certainly women that have hot flashes who have fluctuations in their estradiol level that triggers changes in the hypothalamus and the temperature regulating system and the candy neuron inhibitors. And this is these changes in estrogen can affect nitric oxide levels, can affect catecholamines. There can be surges of adrenal hormones, which are stress hormones, the fight or flight hormones. And so a lot of our patients are plagued with anxiety and palpitations, and they just don't feel as confident or sure of themselves. So, talk about some of the techniques you use in these women.
Some of these issues are rooted from the mast cell response as well. So, if we only talk about the diet, I've seen patients improve significantly with low histamine diet. And low histamine diet is about avoiding the fermented foods. And some of these women have been on the kombucha, and some of them have been having yogurt or some sort of a yeast every day in their life. And they commonly also get body aches and pains. And the moment they go on the low histamine diet, there's a remarkable improvement. And there's some supplements that have choline in it, and that supports a lot some of these catecholamine responses as well. If we move towards the herbs, then ashwagandha, holy basil, um, rhobodia root extract, chasteberry extract, these things are very, very functional as well. There's some evidence about the valerian root and fennel seed that also helps calm down the palpitations and some of these symptoms of anxiety. Chasteberry is typically considered something for more just PMS symptoms, but actually it is working on the progesterone augmentation. So that's why taking it helps even at the time of menopause to improve the sleep.
And I certainly in the past would recommend valerian root, but I know there was a couple reports of liver toxicity. I know that Dr. Minkin, who I interviewed from Yale School of Medicine, who has special interest in breast cancer survivors and sexual function, said that in some of her patients that she can't use hormones in, she uses the specific brand Remifemin um, for black cohosh. And I know in Germany it's regulated like a prescription medicine and they use it for up to 6 months. Do you recommend any certain brands of herbs or supplements? Because, of course, in the United States, anything that's not a food or a drug is not regulated. So there's always that potential concern about contamination or liver or renal side effects with just indiscriminate supplement use. So I was wondering, do you recommend any certain brands, or should people go on consumerlab.com, or how can women be sure that they're getting the best supplement that you recommend?
So I'll be honest with you, if I'm allowed to tell the name of the brands, then Metagenics has actually copied this formula from Germany, and it is having the robotic rhubarb in it, and it is called Astrovera. So this is pretty expensive, but if you go on their website and you register, and of course it takes 3 months for it to see maximum effect, they can they can reimburse your money if it didn't help you for 3 months. So they give you this option, and you are able to use the Astrovera by Metagenics. And this is the German formula, exactly what you mentioned, that have been used there for a long time. And majority of these herbs and botanicals are coming from Europe, predominantly from Germany and Switzerland. And they're vested in doing more peptide uh, just formulation as well. So Metagenics is a very good brand. It's third party tested. The other good brand is the Pure Encapsulation. Metagenics can still sell their product, and you can find them sometimes in Whole Foods with Whole Food labels. But Pure Encapsulation is one brand that they will never let you put their labels on, because majority of these brands are selling to these big companies like Whole Foods, Fresh Thyme. So it's not that all of them are having their own products. They're purchasing it from certain company, and they're putting their own labels on it. So that's why pure encapsulation we endorse a lot in functional medicine, because they do not sell their brand to any company as such. And majority of the time, you have to consult the functional medicine doctors as well to get what kind of dose you need, such as for zinc or magnesium. And then they have DIM also. And we all know that there's a formula out there to balance these hormones that women bring to us, with name DIM. So it is very popular among patients. And then DEA, dehydroepiendosterone, that is also available in certain dosages. And I have seen that pure encapsulation has such effective potency that the DEA numbers do go high when we retest the labs. However, if you buy them from Costco or somewhere else, they're not as good. So
Or
my
they may have twice the amount, or not enough. I
yeah,
I certainly prescribe a lot of vaginal DHEA because there's not systemic absorption, and the endometrium doesn't have aromatase inhibitors. But I do tell women who are specifically trying to avoid hormones that by taking oral DHEA, that's a hormone precursor. And if it goes through the stomach and liver, it does boost estrogen and testosterone levels. So you are boosting systemic hormones, and those then certainly have to be measured. Can you talk about the emerging role of peptides in the treatment of vasomotor symptoms? And certainly, we know substances that affect the KNDy neurons, if they antagonize the KNDy neurons, that a lot of times there's no vasomotor symptoms, which is why we're so excited about the research on these KNDy neuron inhibitors, that we anticipate may be FDA approved later this year.
sure. So at Cleveland Clinic, of course, we always practice what has scientific evidence and is in also FDA approved majority of the time. So we are not practicing the use of peptides in functional medicine at Cleveland Clinic at this time. However, I get the opportunity to attend these conferences nationally and get to know the scholars, what are they doing. And definitely kisspeptin, mitosin C, these are some of the peptides that are imported and commonly given to women in those clinics to help them with the vasomotor symptoms. And they are actually paying a lot of attention. So they are sort of keeping the toxins under check. There are no impurities in those formulations, because these are IV infusions that they're giving to patients who have intense hot flashes and they cannot even take the hormone therapy. So it is expensive at this time, but it is used as a complementary medicine in various part of United States as well. And it is promising because the more we are able to see the benefits of it, the more we are able to get funding for research and then express that, yeah, I mean, this is going to be the future, because we know that certain peptides have already been approved by FDA, and we are using it for weight loss.
And which ones are those specifically? Or is that the new class of the GLP-1 inhibitors you're speaking
Yes,
about?
those are the ones.
Yeah, that is
Absolutely.
really dramatic, and certainly my son, who has his PhD in molecular medicine and cancer genetics, just said to me the other night he thinks that within 20 years we're not going to have any obesity in the United States, which I thought was a pretty shocking statement. But I mean, if the cost comes down and we have more research in terms of long-term effects, cancer, etc., it is really very exciting. What other types of infusion therapies are typically done in functional medicine practices?
These are the cocktails. So these cocktails are energy cocktails, and they really are profound. We are talking about supplements orally, but as we all know that sometimes our nutrigenomics are playing such a trick on us that we are not able to absorb some of these supplements. Let's say magnesium. Some patients do better with transdermal magnesium. That's why Epsom salt bath with the magnesium salt in it helps them relax more and unwind better than taking oral magnesium at night. So, of course,
Yeah,
we
I
cannot just
plan to
like,
go. I plan to go take a hot Epsom salt bath tonight, just to let you know. I'm
with
sorry. Go ahead.
yeah, with a pinch of lavender and
Absolutely, to relax and have a good night's sleep.
so it really does work. So that's why now we have IV infusions with these some very important minerals and vitamins, and they are paired up with glutathione, which helps the liver to metabolize energy better. So glutathione is available in the oral pill form as well, but if you take it with these infusions, they really bring a great amount of energy and detox. And we saw that during COVID times that some of the practices were giving a combination of vitamin C and certain other minerals and vitamin infusions to help patients with their energy depletion and lethargy, and they did do better. So again, we have been using these mineral and vitamins orally, but IV infusions in functional medicine are really at the cutting edge at this time. And it's just not us, it's really across the board that everyone is trying to get interested in it. And these are infusions of B12, combination of B complex vitamins. It will have, like, maybe an appropriate amount of magnesium. Now these are not all risk free, we have to remember. And that's why I think more and more physicians should get into functional medicine, because if we see chiropractors and nutritionists functioning, they will never understand the side effects. Yes, some of these vitamins are good, but we know that they can lead to cardiac arrhythmias. So we can't just give magnesium uncontrolled. We have to be dosaging it according to the history and the medical history, surgical history of the patient. So that's
Right,
why I feel,
and renal function. I mean, it's very concerning. A lot of these IV infusions are popping up and being done, I think, by non-medical people, like in workout facilities and health clubs, and
yeah,
there's a lot of strange stuff going on. So I agree. I think that our medical profession needs to embrace this complementary, alternative, integrative, functional lifestyle, anti-aging, but in an appropriate way that's safe and effective, and looks to the physiology and the research in the individual patient's medical history, which I think a physician or advanced practice a clinician is best apt to be able to do that. So I certainly endorse that. Do you use a lot of oral and acetylcysteine in your practice? Because I certainly, in women over 50 who complain of brain fog, I know there's a prescription vitamin that has the methylated L-methylfolate, which a lot of the population does have MTHFR mutations and don't process regular folic acid, and the L-methylfolate is the active isomer that supports methionine and then serotonin. So I use a combination of N-acetylcysteine and methyl vitamins in a lot of my patients who complain of brain fog with really good results. So I just wondered if you use, because N-acetylcysteine helps support glutathione, which of course is good for brain function.
Absolutely, this is correct. And the other one is L-theanine. That also is at the cutting edge of treating the palpitations and some of these anxiety symptoms when we feel sort of like bouncing all over. Then L-theanine is a good supplement as well.
Now, I had a
So
lady today who told me she was taking L-serine. Are you familiar with
so
that? Or also
yes, and
taurine for anxiety.
mhm. It is because when we see high cortisol levels, sometimes we opt to use serine. So, these are the ones that sometimes I have to personalize them after checking some of these labs. So we are not missing on anything else because there are like other reasons for palpitations as well. But if we have ruled out everything and we only see that it's high cortisol and that's why they're not able to get more relaxed, then these supplements go a long way to help them. But
So I
again,
think,
working on the gut function pays a lot. And I will share one other tip with our listeners today, Dr. Thacker, that sometimes when we talk about these supplements, they feel like, oh, it's just so expensive. And, we are just going to be just like selling them these supplements and it all is just basically excreted out and we don't get much benefit. But that's not correct. Initially, when we identify the deficiencies. And that's why I say that training is so important as a physician to know the renal function, to know the kidney and the liver, what is their status, so we can personalize the dosages is so critical. And then once we have replenished the stores, really I tell them to take it every other day. Like if I have seen that their DEA levels are optimum and they're doing well, I begin to tell them to take it on every other day because they have already repaired their gut, their energy is better, they're moving in the right direction. So, our ultimate goal is to get them on the least amount of supplements that are needed, and those will be ultimately vitamin D, magnesium, and a good multivitamin. And those also I tell patients if they're majority of the time eating healthy, they can skip a dose here and there and not worry about it. So no one wants to be ill to a pill in today's world. So we all want to limit them and promise them that yes, we are replenishing your stores, but it's not going to be forever that you'll be investing in these vitamins. And that makes them feel very liberated. And I tell them also that if they're buying it expensive from pure encapsulation, they should remember that it is also pure and ultimately they will need less rather than buying 180 tablets from Costco and not knowing what is in there.
In terms of me prescribing supplements, since I practice in a northern climate and most of my patients are over 40 and the skin doesn't convert vitamin D as well. Plus, in the field of women's health, we women want to protect our skin and not have increased wrinkles and collagen loss from ultraviolet light exposure. I pretty much have almost every single patient on some amount of vitamin D3, sometimes with K2 added to help drive the calcium into the bones and not the heart. And then I would say probably next after that's magnesium, because a lot of women just don't get enough in their diet. It helps with sleep and leg cramps and migraine headaches and certainly constipation, assuming there's no renal failure. And then it kind of depends on zinc levels and B12 levels and other comorbidities. A lot of medications depress B12 levels like metformin and PPIs. And some people, of course, have gut surgery or, and
Yeah.
gut issues. I think musculoskeletal symptoms are very, very common. And we know that there's estrogen receptors in the bone, in the cartilage. And some women don't have vasomotor symptoms, but they just have joint pain. I get a lot of consults from rheumatologists who rule out connective tissue diseases. And certainly I do think estrogen has a big role in musculoskeletal health, muscle balance, bone density. But I do think that there's a definite role for supplements in musculoskeletal pain. And several years ago, when some of the research was coming in about glucosamine and chondroitin sulfate, I recommended it to patients. And I remember there was a physician that reported me to the front office for supplements that their dog took. And certainly, I guess the veterinarians do prescribe that. And that was before we had any complementary, functional, or integrative medicine. And I certainly do use a lot of, especially in people that don't have shellfish allergies, glucosamine, chondroitin sulfate, the patients on aromatase inhibitors with breast cancer who have terrible musculoskeletal symptoms. I was wondering what other supplements or herbs that you use in people with joint pain, because certainly DJD, osteoarthritis, perplexes a lot of our patients over age 50.
We'll be back after a quick break.
Have you ever experienced fitness failure? You know, you set a goal to exercise, you're all excited, and then you're not. Hi, I'm Dave. I host the daily 10-minute podcast, Walking is Fitness. Instead of an exercise goal, I talk about making a fitness promise. And every day you keep that promise, you add another link to a growing fitness chain. This is a podcast of action. You'll create a fitness habit, which eventually becomes fitness momentum, and then on to all kinds of good stuff. Check it out. Walking is Fitness, and let's take a daily 10-minute walk together.
Well, inflammation is a big reason for that. So we have to target the inflammation, and turmeric, curcumin, these are big ones.
Oh, yes,
Turmeric
turmeric, yes.
it's coming in various formulations, but our personal favorite is Mariva that we prescribe commonly in functional medicine. And that is a very potent combination of curcumin and turmeric. And again, like, initially it is given in very consistent way. And later, once they start feeling better, we sometimes spread it out. Omegas are great because omegas also bring the inflammation down in the body. Paired up with magnesium, sometimes I don't even have to use any other pain medications. But I'll tell you one thing, when patients are really suffering, we commonly are using naltrexone. It's by tricking the opioid receptors that we're trying to help them with inflammation and pain. And it's just not pain in the joints, the just kind of an unusual expression of pain in the gut that they've seen so many gastroenterologist and still it couldn't be figured out. It gets so much better with tapering dose of naltrexone. So this is something that we are using very commonly in functional medicine, and so far it has been proven to be quite safe. And we have not come across any side effects to this particular treatment for inflammation.
I'll definitely have to have you on another Speaking of Women's Health podcast to talk about that in more detail, and maybe have you write us a column on speakingofwomenshealth.com, because I think that chronic pain, gut health, are just all such common, vexing problems. And of course, after we do our standard, medical workup and we rule out problems, we want to be able to offer things. And sometimes dietary changes, supplements, lifestyle changes really can make huge differences in patients. I had a woman today in my practice who told me she had terrible abdominal bloating, came to see hormone doctors for hormone evaluations, and she saw a functional medicine doctor who put her on oregano and caprylic acid, and she said it totally resolved her bloating. So is that related to like small bowel overgrowth, or I'm wondering what the role of that combination of that oil is?
Yeah, so small intestine bacterial overgrowth is a big one. SIBO, that's how it is, so it's just in the common language um, expressed. But we have very sophisticated testings available to test for what kind of bacterial overgrowth is there. Sometimes just targeting the bacteria is not correct. At times we have come across yeast infections, and treating the yeast has helped tremendously. So certain combinations work very well. And you'll be surprised that there's a supplement with olive leaf extract as well that helps so much with the gut issues and bloating. So you treat everything, and then patients are still bloated. And olive leaf extract is so subtle, and it has really profound effects on the gut that they are able to recover well from it. Then you have to replenish their bacteria in the correct way as well. So that's why if you want to personalize and tailor it according to what is overgrowing, we need to do this testing. It is not covered always by insurance, um, and it is $300 test, but it really helps.
Now, sexual function concerns are also an issue, and certainly if you lose your sex hormones at midlife or have oophorectomy or have effects from cancer therapy, there's obviously definite physiologic changes to blood flow and the genitals, and there's lots of approved therapies that we can even use in patients who can't or won't take systemic hormones, and we've discussed those on some of the other podcasts. But I wondered if you had any functional medicine recommendations for improving nitric oxide. Certainly we know estrogen does that. I always teach the fellows that local estrogen is the female Viagra equivalent because it does improve, blood flow and nitric oxide. I wonder if there were any other supplements. I know over-the-counter Zestra lotion we recommend because that can improve the ability to climax and improve blood flow to the clitoris. I wondered if you had any other functional medicine recommendations in terms of female sexual function.
So DEA is a very good one, and getting DEA levels checked first, and then adjusting the dosage because there are formulations of 25 milligram twice a day as well. So I've seen remarkable difference in their sexual well-being if we correct their DEA imbalance. Of course, testosterone is
Yes.
a big one.
Yes, although again, that would raise systemic hormones. So some patients who can't or won't take hormones, vaginal DHEA, I think, is very safe and effective.
Yes.
I'm talking about other non-hormonal options or non-precursor hormonal options.
So, for the vaginal atrophy, we have studies that support that fennel is a really good herb that helps with the vaginal symptoms and atrophy as well. And I don't want to quote that, but there are certain holistic clinics that are actually doing steam therapies with it that are helping patients in a very natural kind of a way. So, fennel is one herb that I can say that it could be safely used because we do have scientific evidence for that. And I am very blessed to have my training in menopause, and I'm certified menopause practitioner too. So DHEA is in vaginal formulation is such a like a I think a winner for these patients because you can adjust their dosages, and sometimes you can even tell them to cut the suppository in half and take half of it, and even that makes a ton of difference for them.
In terms of the dryness, yes. And do you use off-label PD5 inhibitors like Viagra and Cialis in women? I know a lot of sex therapists do that.
I don't have experience with that. I do coach them on meditation, though. I feel that sex, in its own way, is sort of a whole meditative process. So everyone has to be present in that moment as well. And sometimes I feel that there's so much resistance for patients to even talk about it, that they have to really talk about it with their partners, that they how they like it and how they want to do it. And secondly, even for going to the gym and working out, you need an attire. You want to be like, all dressed up to be in that mood. So there's certain other ways that they can also try to complement when hormones cannot be an option. So, you have to give that confidence back to patients and help them with, just processing it as a part of their health, because sometimes they do not think that it's a necessity and they can overlook that, but actually that's not correct. And meditation is one thing that brings their focus back. And intimacy is still so important. If, for some reason they cannot have the actual connection, then at least, staying intimate with their partner and knowing that this is part of their health is very, very vital. So I do help them in a very holistic way with a sexual approach as well. But at this point, I have no experience with Viagra and Cialis in my practice.
Well, thank you so much for joining us in the Sunflower House, Dr. Sobia Khan, functional medicine expert, women's health and menopause expert. Thank you so much for sharing your insights. And thanks to the group who've joined us for your free CME. Go to menopauselearning.com. Please give us a 5-star rating and subscribe to our Speaking of Women's Health podcast at all the usual places that you get a podcast.